Okay, I'm going to get us started right on time because I want to get as much time with our speaker as possible. Oftentimes the academic bios, I think, can be a little bit sterile. So I'm going to do a little bit more of a personal introduction insofar as to say that I've been following Dr. Morello-Frosch's work since before I started my doctoral program. Her work on the climate gap, which I think she's going to talk about, was a report that I saw when I was a program administrator working at a community health center. And I said to myself, this is the type of work that I wanted to do. And so I've been following her work for quite some time and am always super excited when I get to invite her. Amongst her many academic and professional distinctions, Dr. Morello-Frosch was a member of the White House Environmental Justice Advisory Committee under the Biden administration. She is an elected member of the National Academy of Medicine, amongst many other accolades. And currently, she is a professor at the UC Berkeley, but she's taking this year and doing work actually at Harvard in the Radcliffe program. Fellowship program. So you can read the rest of her bio, but let's welcome Dr. Morello-Frosch.
Thanks. Thanks, Daniel. Oops, hear me? Okay. Yeah, great. Well, thanks for having me. I love coming here. You guys are doing amazing work, and I think you were responsible for me 1,000 years ago having me come to Columbia when I was.
I was.
Yeah, there. So thank you for inviting me back. Yeah, so today I'm going to have what might be a little bit of an unconventional talk, and that it's going to be sort of a bird's eye view of this work, but with a focus on how we're trying to document the problem of issues that threaten related to climate change and climate drivers. But then also try and do something about it by developing tools for diverse end users to facilitate action. And this, I think, is increasingly more important given what's going on right now and the disappearance of data that we all rely on to do this work that that is so important and, quite frankly, that we love to do. So, as Daniel had said before, we a while back when there was no federal movement related to climate change in the early 2000s, there was at that time a federal bill to start to address that was climate change that known as the Markey Bill, and there was momentum to try and get it passed. And at the time, we were asked to look at, there was a lot of discussion about climate inequities that we're looking at wealthy countries versus less wealthy countries in that international context, but a lot less about what was going on within the United States and this notion of climate injustice in terms of the ways in which climate change disproportionately impacts structurally marginalized populations. That now seems like very passé. So many people are working on this, but at that time it hadn't really been on the radar. And so we did produce that report for actually busy policymakers. We published a paper on it too, but we knew they wouldn't read that. So we created this report called The Climate Gap. And since then it has, a lot of researchers, advocates have been working on questions of climate justice now for a really, really long time and doing great work, including work here. And so we tried to sort of revisit this notion of the climate gap, but with a focus on racialization in this article that was shared with you in the New England Journal, trying to just understand, like, we got here for a reason. There's, a history of housing and land use policies that are rooted in forms of structural racism, where in terms of the real estate and lending industries, other kinds of things that have led to the landscapes that we see now, where there's racialized segregation, wealth and income inequality, and inequalities in political power, which has enabled the creation of sacrifice zones, which have allowed and perpetuated the ongoing emissions of greenhouse gases and their co-pollutants, which environmental justice communities that disproportionately host these large greenhouse gas emitters know about all too well. We also wanted to, point out that it's not just privileged communities that live in certain areas, but it's those of us who are also part of this system where, those of us who are investors, have stocks, consume, there's the benefits that and perpetuate the system in that way. And then there have been forms of regulatory abandonment where certain communities are just not benefiting from regulatory oversight, as well as more privileged, wealthier communities. And this creates what we have called the climate gap, looking at racialized and class-based disparities in the effects of climate change, whether we're talking about extreme heat, extreme weather events, but then also just the ability to recover from these events, the displacement that inevitably happens. And I would add, and I don't have time to talk about it today in my lecture, but happy to talk about it in Q&A. Some of the policies to address climate change also have disproportionate impacts that we obviously don't, even though it might help reduce greenhouse gases, it may not necessarily be particularly beneficial to marginalized groups. And we've tried to address this a bit in California. So if we look at drivers of environmental racism, people often talk about racial residential segregation. People often point to a history of redlining. How many people here know what redlining is? Raise your hands. How many people don't know and would like a quick and dirty explanation? Don't be shy. Okay. So I think people talk about that redlining started happening in the wake of the Great Depression with the creation of the Homeowner Loan Corporation. And I think it's important to remind people that the creation of that entity was actually to help people from defaulting on their mortgages in the wake of the Great Depression. It was actually a potentially great policy. The problem was there was the racism in the way it was implemented and the creation of these redlining maps that had led to the patterns of racialized residential segregation that we see here. These are metropolitan statistical areas in the United States. There's about 310 of them in this map. And so these maps are very powerful. You see these maps, you see the red, i.e. the degraded neighborhoods. You can see now, if you go to mapping inequality, you can see the descriptions of the neighborhoods, many of which are racist and explain why they got a low grade and why they are not the beneficiaries of government investments to help bail people out. But I want to remind people this didn't start in the 1930s. These maps were simply reflections of the kinds of racist things that were happening at the municipal level, at the state level, at the federal level for decades prior to that. But I think sometimes we overemphasize these maps and we say that this happened in the 1930s because of federal redlining. And historically, I think it's important to say that this just reflected what had been going on for a long time. Okay, so there's been a proliferation of work, some of it here and in other places, looking at the ways in which redlining exerts its influence on current environmental conditions. This is an example of a paper that we published about 4 years ago, looking at the relationship between the presence of green space and historical redlining. So the map here is looking at the grading of the neighborhoods based on these Homeowner Loan Corporation maps, and the red ones are the graded D. And then here are quintiles of green space, and visually, you can see that neighborhoods that have been redlined currently have a lot less green space, not surprisingly. And this has implications for vulnerability to climate change. And again, lots of people have published great work. This is just a smattering of example from our team, but we see both patterns with racialized residential segregation, but we also see that communities that are more vulnerable to extreme heat have worse health outcomes. There's been some nice work done on perinatal outcomes. Risk of spontaneous preterm birth associated with heat. We published a paper along with several others showing that there was a very strong relationship, and particularly in terms of exposure to heat in early pregnancy, and that these associations between exposure to heat and preterm birth were strongest in communities that had high levels of racialized poverty. Here's another example looking at a fundamental driver of climate change, looking at the distribution of oil and gas wells by historical redlining. So this is looking at 33 US cities that had redlining maps available, okay, and that also had oil fields where you could potentially drill for oil. And what we sought to look at is to what extent do we see a relationship between the grades of a neighborhood and the presence of oil and gas wells over a period of time. So this is looking at, here's the grade of the neighborhood and then the number of wells. And you can see that, you know, D has the highest number. So kind of cross-sectionally. And then what we wanted to look at was, what do we see before these maps were drawn? What's the pattern? And we do see still the highest number in graded D neighborhoods. And that's not surprising because another one of the criteria for redlining neighborhoods was the presence of industrial activity, okay? But what we do see here is after we look at, after these maps were drawn, these patterns only accentuate, you know, more post redlining. So when you redline a neighborhood, it sort of gives it license, if you will, to keep placing more and more wells in these same neighborhoods. And a lot of fantastic work has been done looking at the adverse health effects of living in proximity to active oil and gas well activities. For a period there in California, most of the work had initially focused on places where, for example, hydraulic fracturing really emerged, like in the Marcellus Shale and in Texas, where fracking was really popular. In my state of California, our oil and gas development started well over 100 years ago. We actually don't have high rates of fracking in my state. But nobody had really looked at perinatal outcomes until we started doing this work, and then there was more and more studies. But about 3 million people in California live near an active oil and gas well. And subsequent studies, including ours, have shown increased risks of having a low birth weight baby, a small for gestational age birth. Some studies have found conflicting results, but increased risk of preterm birth. And then in the places where there is fracking in California, we saw even stronger effects. And then some studies suggest that maybe these relationships between proximity to high production volume wells and adverse birth outcomes, particularly for preterm birth, are stronger among Latinx pregnant people. So one of the things that I had the pleasure of doing was co-chairing a public health expert panel in California, because there was a lot of concern that the governor was still like doling out a lot of these oil and gas well permits or renewing them in very sensitive places. California is also unique that a lot of the oil and gas development is also in urban areas, which is kind of interesting. High concentration is in rural areas, but because our infrastructure is so old, a lot of urban areas grew up around oil and gas wells subsequently. So, and colleagues here were involved in this public health expert panel, like Professor Nicole Diesel was a member of it. And as a result of our work and our assessment of the literature, it provided the foundation for passage of SB 1137, which has required more tighter regulations of where permits can be issued within a certain buffer distance of where people live, and also other vulnerable so-called receptors, including prisons and other places where people, schools, hospitals, daycare centers, parks, etc. And the reason why, this is just, one example. This was, believe it or not, one of the first studies in California looking at the birth weight effects. of proximity to high production volume active gas wells in California. And the reason why we felt compelled to do it, even though there had been so much great work done in Pennsylvania and in Texas, is because the oil industry was saying in California, we don't do fracking. This is different. It's not a risk. And you don't have any evidence that it's bad for perinatal outcomes. And it was true. We didn't have any evidence because there just wasn't any data about California. So this is what motivated us to do this study. And so what we did see here was that high production volume, which is the triangle compared to the lowest, no exposure, had a higher increased risk of a lower birth weight, particularly for rural areas, not so much in urban areas, which is sort of interesting, and a dramatic decrease in term birth weight. And we didn't see strong effects for, preterm birth in our study, but other studies did see modest elevated risk of preterm birth. Okay, so thinking about these hazardous facilities that the environmental justice literature has shown tend to be disproportionately located in communities of color and other marginalized communities, we started to think, can we do more kind of solutions-based science as opposed to always documenting the problem? Documenting the problem is a good thing, but now that, are there opportunities out there for us to document some of the health benefits of policy change? And so one of the things that happened in California in 2006, under a Republican administration of Arnold Schwarzenegger, we passed the Global Warming Solutions Act, which at that time was a very ambitious law to reduce greenhouse gas emissions in the state. So this was the first law that was passed, and this is where we were, and this is where the first law wanted us to be, and we were able to hit that pretty quickly because of this law. And then it was about 3 years ago, it was renewed, and these are our current goals in terms of projected reductions. Getting to here is a lot harder than it's been getting to here, because we took care of a lot of quote unquote low-hanging fruit, which I'm going to talk about in a second. So there was a lot of organizing and a lot of work to get this law passed. And while that was happening, and it was becoming clear to the utility industry that some law was probably going to pass that was going to regulate greenhouse gas emissions in California. And at some point, industry was going to have to start paying for something they used to be able to do for free, which was emit greenhouse gases. Okay, they started doing assessments of which of their power plants are not likely to be quote unquote efficient or profitable. And so they started retiring some power plants in the state. And so with a colleague of mine who was at Berkeley with me as a postdoc, she's like, we should see if we can see any health benefits from these power plant retirements. So Joan Casey, who's now a professor at University of Washington, and I was like, yeah, this is a great idea. So this is where these power plants retired and the years that retired. And what we wanted to see is it possible that we could see improvements in air quality when we compared pre and post retirement periods. So this is looking at average changes in, this is just looking at air quality monitoring networks near where these plants were. So it's not perfect data. We weren't like out there actually measuring the air quality ourselves, but this is looking at air quality within 5 kilometers of power plants, within 5 to 10 kilometers of those power plants, and then 10 to 20 kilometers. And you can see this is the levels for before they retired and levels after they retired. So you can see there was a slight decrease, at least that we can see a little bit from the air quality monitoring data. And then the question was, can we see a relationship where we see a reduction in preterm birth rates associated with the closure of the power plants, okay, or the retirements. So what we see here, if we look at this graph, is that California power plant closures were associated with about a 2% reduction overall. And this red line represents power plants that were within 5 kilometers of a plant that retired. And this is within 5 to 10 kilometers, so a little further away. So on average, we saw about a 2% reduction in preterm birth rates overall. And the strongest effect were for preterm births that were between 32 to less than 37 weeks. And then interestingly, when we stratified by the self-identified race of the pregnant parent, we see slightly stronger, albeit these are, these confidence intervals are unstable and quite wide, but slightly more beneficial potentially effects for Asian and Black self-identified pregnant people. So this is, using kind of what we call difference in differences methods to look at potential short-term health benefits of changes in industries, in this case, power plant retirements, most likely in response to public policies, changes, in this case, anticipating the passage of the greenhouse gas reduction policy in 2006. Here's one we're working on now. So we literally just submitted this a couple days ago. So there have been some refinery retirements in California. So what we wanted to do is to look at, can we identify any health benefits from these refinery retirements? There have been 4 that we've been able to look at. These are the study areas. So this is in Northern California, kind of where I am, and then also a couple in LA. So these red dots represent the 4 refineries. And then here, what you see is these are the different refineries that you see in close-up. And we tried 2 different exposure assessment methods, but I'm just showing you this one, which is looking at ZICTAs for each refinery based on ambient 2.5 estimates that we attribute using air quality modeling, the INMAP model, that are related to what we think the refinery impact is in that area. And then we, again, are asking ourselves, do we see a signal in terms of reductions in adverse perinatal outcomes? And the answer here is much more complicated, okay? So this is looking at preterm birth. This is looking at decrease in term birth weight. And this is looking at small for gestational age. So this one is in my area, in the Bay Area, and this one closed around 2020, right after the COVID epidemic started. Like literally, it shut down in June, and we shut down in March. These other ones, we see more of an effect in terms of decreases in term birth weight, decreases in small for gestational age, slight signal here, not so much here for this one. We're not really seeing much for preterm birth effects. So the signals are a little bit more complicated, but there is some suggestive evidence, at least for this particular refinery, that we might be seeing some short-term health benefits. This one is very complex because of the noise introduced by the COVID epidemic. A lot of things changed during that period of time. There was no vaccination yet. Subsequent studies have shown that exposures to COVID infection during pregnancy can increase the risk of preterm birth. So it was very difficult to sort out some of that residual confounding, despite our best efforts to even take into account COVID rates and things like that. Okay, so I want to switch gears. So we're looking at some of these drivers of climate change or sources of greenhouse gas emissions. And we want to look at basically kind of what does it mean for marginalized groups in terms of impacts. So we worked on a study with colleagues at Climate Central. Some people might be familiar with their work. They do a lot of work to project sea level rise both in the United States and globally. So they have a science arm, and they do a lot of technology visualization. They also, until recent, they have a journalism side, which is very separate from their science side. That actually is about to get phased out, interestingly enough. One of the first studies that we collaborated with them on was to look at sea level rise related flooding threats to housing stock by state in the United States. So this is just, can we project threats to the housing stock in different states based on different scenarios? So this is obviously the worst case scenario, business as usual. So on this left-hand side, this is looking at the number of housing units exposed per year, okay? You can see kind of the states where it's higher versus lower. And then this is looking here, the expected number of units exposed to a flooding event at least 4 times per year. So places where like they're really low lying and they're already starting to experience some flooding events and are likely to have more. And then down here, this is looking at the percentage of housing stock that's exposed per year by state. And the yellow bars represent sort of the general housing stock. And the green bars are what would be considered affordable housing. Either it's because it's subsidized housing or because it's a lower rent area. So it could be market-based affordable housing or government housing, et cetera. Okay. This is just looking at now by cities that we are super duper vulnerable. And this is looking at the expected number of units that are potentially exposed, depending on the city and kind of what the range is. And this is looking for every year, and then the expected number of units exposed at least 4 times per year. And then this is looking at the percentage of each type of housing stock, affordable and general housing. And you can see that there are some cities like near where I am, Foster City, which is really, really, really low lying. In some cases at sea level, a lot of the housing stock, almost 100%, is projected to be vulnerable. So this got us thinking with some environmental justice partners in California that were working on climate adaptation and resilient strategies in different cities where they were doing and regions where they were doing organizing. Can we take this data on projected sea level rise estimates for 2050 and 2100? And can we integrate it with really thinking about potential surface flooding threats to hazardous facilities that we know are disproportionately located in environmental justice communities? So we started to think about another project and really taking into account that, sea level rise is definitely accelerating. A lot of the models are, there's been a lot written about some of these models are underestimating the rate at which the sea level rise is increasing. And the projections about threats to low-lying coastal areas. And we know that there's, rapid increases in the frequency of high tides expected in several U.S. cities within the next decade. And then we have these major storms that happen where, like Hurricane Harvey in 2017 was pretty devastating. And particularly for communities that were living near industrial facilities, refineries, oil and gas operations, ports and terminals. So it was huge releases of air pollutants and also land releases and water contamination that occurred. And so we decided, okay, we need to try and develop a screening approach to try and project which types of facilities in low-lying coastal areas might be at risk of sea level rise related flooding threats. So this is our team, and it was a collaboration with my folks at UC Berkeley and my colleague Laura Cushing at UCLA, Climate Central scientists who do all the sea level rise projection work, and then our EJ and public health partners that were co-created this project with us and gave us, worked with us really closely to develop what I'm about to show you. And this really was just trying to acknowledge that many of these hazardous facilities are disproportionately located in communities of color. Most of the work when we look at sea level rise projected flooding threats focus on property values and costs rather than health threats to people. And so this type of project could really sort of take more of an intersectional approach to look at sea level rise, the presence of hazardous sites, and potential threats to environmental justice communities in a screening way that could be helpful. So the goal was to do a national assessment of flood risk due to sea level rise, and look at the extent to which marginalized groups are more likely to live at sites that are at risk of flooding events. And in addition to publishing a paper that only our colleagues are going to read, we wanted to create a data tool that would inform resilience, community adaptation planning, and other efforts, and sort of inject an equity perspective on this kind of thing. So the way we worked together was, again, as I said, we co-developed. We got funding both from the Strategic Growth Council in California and US EPA STAR, and that grant got canceled and then it got reinstated. So we were able to finish our work, which is really great. And then the way we worked is, the science team would develop data visualizations, analysis. We would meet with our EJ partners on a regular basis. They would give us feedback on our analysis and help us ground truth. For example, our maps of all the hazardous facilities. We started out in California, which was an area that we knew well before we scaled up to the rest of the country. And then they would give us a lot of feedback. And then as we were developing the data visualization tool, which I'll show you a mock-up of in a second, they gave us a ton of feedback on how to make that accessible and user-friendly, et cetera. So it was a kind of an iterative process. Okay, so what did we do? Well, first we used publicly available data to create a national data set of hazardous sites, and we geolocated about 48,000 facilities and coastal sites that are known to emit, use, process, or store toxics and materials. And so lots of data sources, including EPA's Facility Registry Service. For refineries and oil terminals, we use the Energy Information's Energy Atlas. We use data from the U.S. Army Corps of Engineers. And then in order to geolocate all active oil and gas wells across the country, we used a proprietary data source from Enverus. And then we classified facilities into categories based on their NAICS code, which is a code that sort of enables you to get a sense of like what kind of producer are they? Is it an animal operation? Is it a power plant? Is it a toxic, in chemical manufacturer, et cetera? And then we estimated, we spent some time using tax parcel data for these facilities so that we could get a fairly clear picture of the extent of the property, like how big is it? It's not just a dot on a map. And then for those for which we did not have tax parcel data, we did an estimate of what the facility extent would be based on the category that they were in and the average size of these facility visible extents, and we drew a buffer based on that for those for which we didn't have tax data. So then we derived coastal flood probabilities for each of these facilities. And we used a metric called the expected annual exposure. So it's the chance that each year that there will be a flooding event that's high enough to at least partially inundate a facility site. And we do that using return level curves at tide stations. And there in the US, there are about 50 of them and 55 of them, I think, yeah, with about 30 years worth of historical data. And then we compute, or I should say Climate Central scientists compute those and to say, given any water height, what are the chances that the year's highest coastal flood exceeds the height of the facility in terms of its elevation? We used, LiDAR digital elevation models to locate these sites, and the sea level rise projections take into account things like levees and flood control structures, and other kind of hydrological connectivity of, for example, rivers and other water bodies to the ocean. And we derive these sea level rise projections using both the reference concentration pathway, like where we're really getting our act together at 4.5, to business as usual of 8.5. And we did those projections for 2050 and 2100. And we defined a facility site as at risk as any site that had, whose 25th percentile elevation had an expected annual exposure of at least 1% or a 1 in 100 year flooding probability. Okay. That's the first part, is categorizing facilities that are at risk and not at risk based on what we know about sea level rise projections and the elevation of these facilities. Then we're starting to characterize the communities in which all these facilities that we have assessed are located. And our unit of analysis for those low-lying communities are census block groups, okay? And we classify block groups as quote unquote exposed if they contained people that were residing within 1 kilometer of an at-risk site of flooding. And we had 3 outcome metrics. I'm only going to talk about one. So you had to have at least 1 facility at risk, yes, no. But then we also looked at we summed the total of at-risk sites within 1 kilometer. And then we also summed the total expected annual exposure across all risk sites, which is a continuous outcome. And then we characterize the block groups by their demographics and social marginalization indicators using census data. We also used voter turnout data as an indicator of civic engagement capacity of communities. And then we also used the climate and economic justice screening tool that was developed by the Council on Environmental Quality to help direct Biden's Justice 40 initiative. Okay, so here's an example of our coastal areas, and so anything beyond there would be considered excluded, but this would be included in terms of our universe of 48,000 facilities that we're including in our analysis. And then within the block group, we are focusing on areas that block groups are considered at risk if they have a population, which is in these blue blocks, that are within a 1 kilometer buffer of a facility site. Okay, so what did we find? So for this graph kind of summarizes all of our results. So on this left side are the results for projections for 2050, worst case scenario, RCP 8.5. And then these are the projections for 2100. And so for 2050, we estimated over 3,700 facilities are at risk of flooding. and for 2100, about 5500. Okay. And so what you can see here, each one of these colors represents a category of facilities. So we have everything from power plants, animal operations, sewage treatment facilities, hazardous waste treatment and disposal, toxic release inventories, landfills and incinerators, cleanup sites, so Superfund sites, for example, refineries, fossil fuel ports, terminals, active oil and gas wells, and formerly used defense sites where there's often extensive land contamination. So you can see, like, for example, not surprisingly, a state like Louisiana, the most predominantly at-risk types of facilities are oil and gas wells because they do so much drilling really close to the coast, not surprising. But then other states like New Jersey, Florida, a lot of their risky sites come from industrial facilities. The other interesting thing I want to point out is 7 states account for 80% of the at-risk sites, okay? So Florida, New Jersey, California, Louisiana, Texas, and New York. So that sort of points to, if we're going to do something about it, there is a place where we can focus. Okay, so then what are we thinking about in terms of the demographics of the block groups that are at risk? This is just a simple comparison of looking at block groups that have no at-risk sites, and then block groups that have at least one or more at-risk sites. And then these are the demographics. So for example, the percentage of non-voters. You can see that for the most part, it's the block groups that have at-risk sites that tend to be more socially marginalized. Interestingly enough, with the exception of the percent under 18, it's is in the opposite direction that one might expect. But again, these are just simple kind of descriptive statistics. Let me finish.
Those states are mostly majority people of color states to begin with, right?
Yes, but this includes everybody. Yes. This is the whole US. But what I'm saying is when we sort of do the accounting of the 5,500, 80% of those 5,500 are accounted for those states that, yes, have majority people of color. Yes. And that politically speaking might be a little bit more difficult to do something about climate. So we can definitely talk. Okay, so then we wanted to look at, do some more statistical analysis in terms of what's the likelihood of an at-risk, the extent to which does the likelihood of hosting an at-risk site increase with the proportion of marginalized residents? And again, this is showing you for the 2100 projections. And this is looking at each variable alone. And then we're also accounting for the population density and county to account for regional differences. And this top one, disadvantaged status, that's the one that's derived from Biden's climate and economic justice screening tool. And so you can see that there's a 50% higher odds in disadvantaged communities of hosting an at-risk site defined by this the Biden administration screening tool. But then using census data, for example, we can see that as the proportion of renters increases, you see an increased risk of hosting an at-risk site. So it's about a 41% higher odds per standard deviation increase in the proportion of renters. And so it goes, with all of these, and then these are the ones that are not significant. But this is looking at them all together. And then just to show you, we did some sensitivity analysis. So what I showed you in that figure just now looked at 1 kilometer, and then we redid the analysis to look at 3 kilometer distance of at-risk facilities. And there's not a huge difference there in effect estimates for the most part. So what I just showed you was overall risk across all facilities. But then we derived what we call concentration indices for the cumulative distribution of at-risk facilities by the facility category. So this is like a Gini coefficient that we derived to see the extent to which there are inequities by facility type. So the negative values that are in orange indicate a disproportionately higher burden of at-risk sites for marginalized groups, while the positive values in blue indicate that the burden is disproportionately lower for those groups. And then the non-colored ones indicate lack of statistical significance. So, you know, for example, you can see here that for active oil and gas wells, Native Americans have a disproportionate burden given their representation. And so you can start to see a little bit more nuance here when you start disaggregating your data by the facility types. So in conclusion, in terms of this analysis, 5,500 hazardous sites are threatened by a 1 in 100-year flood event by 2100 due to sea level rise. And I want to stress, you know, most of these are going to remain at risk even if greenhouse gases are reduced. 7 states account for about 80% of these projected at-risk facilities. And again, we use static population estimates, okay, because we focused on contemporary demographics. But these results could change a lot depending on what happens with flood risk mitigation efforts or people moving, demographic shifts, things like that. And there's a lot of uncertainties and limitations to this kind of work, not surprisingly. So we could have over or underestimated the number of at-risk sites. There are a lot of types of hazards that we were not able to account for because we were focusing on national data sets. So for example, we didn't have oil and gas pipelines because the data on that are not that great. We did not account for groundwater upwelling, which is a huge problem in coastal areas due to sea level rise. We did a separate analysis in California that we published a couple of years ago in Environmental Science and Technology, and there we were able to account for groundwater upwelling because there is better data in California on that. And you know, we assumed a constant frequency and magnitude of flood events into the future, and the models that we use to look at and estimate sea level rise may overestimate exposures in some of the more extreme storm events, but, you know, again, hard to tell. And so what this screening approach really is to look at where are these at-risk places, and then where should we be doing more concentrated place-based work to really assess what's going on in these places. As a result of our work in California, the federal agencies did pony up a lot of money to help communities that were flagged as at risk to do more localized assessments of the hazards that were there and to start to come up with remediation and adaptation plans. Okay, so we have a paper that's going to be on this stuff that I've just showed you that's going to be coming out on Thursday in Nature Communication. But I wanted to show you that along with the paper is we're releasing a bilingual data visualization tool of these sites that are geared towards diverse end users. So you can look at these demographics. You can change the scenarios if you want in terms of risk threats, the time frame, and then you can look at the different kinds of demographics that you're most interested in, or the specific facility categories that you're most interested in. And then you can click on the specific facilities and it will take you, for example, to EPA's database where you can learn more about these facilities, what they're permitted to do, these kinds of things. So that will all be released on Thursday. And then the other thing that Climate Central has been doing is something which they call flood vision, which is, in addition to showing these maps, which is really great, how do you project and really enable people to see what these sites will look like in 2100? So we've created story maps for that as well. And that's it. Thanks for your attention.